Hi, this is Dr. Craig Dorr, and once again we are here for our monthly podcast. We are very privileged today to have Dr. Michael Ingui with us. He is going to be a massive resource as we add new technology to our office. He's actually one of the foremost authorities of that in our area. So he's going to be kind of guiding this podcast for once. Actually, I'm not going to talk as much as I normally do. And I'm going to kind of just let him go on about a lot of the topics that we're going to discuss. He has a lot more experience as we're bringing this new into our office. But first of all, thanks for coming over.
Oh, my pleasure, Dr.
Especially during the holiday season.
No, of course.
We've known each other for a very long time. I hate to say since he was in school.
Yes.
And he's been in practice
He's
for a while
older
now.
than me, so
That's scary enough in itself. But what we want to talk about is, and Bergen Chiropractic has had radial shockwave for quite some time. But for the most part, people just say shockwave. Mm-hmm. We don't make a distinction between the different types of shockwave that are actually out there. And even when we talk about focal, I want to talk about the different types of focal too.
Absolutely.
So why don't we start with that? Why don't we start, what is really the difference between the different shockwaves that we have out there?
Yeah, no, absolutely. And I think that's a great question because you do hear shockwave as a buzzword a lot. And there is a distinct difference. First off, the machines are completely, when you look at them physically, when patients see them, they're like, what is this thing? It looks literally like an IBM computer from 1974. Yeah. And the truth of the matter is, it's because of the way that the technology is developed. So focused shockwave, unlike radial, actually utilizes a very high-powered focused acoustic wave. And it actually stimulates tissue regeneration and stem cell growth, which we'll kind of get into in a little bit.
Yep.
Now, radial shockwave, and I'm glad you actually said that because a lot of people call it shockwave, and really it should be known as radial pulse wave. Because ultimately what radial shockwave or radial pulse wave does is it uses a high-powered air compressor, and there's a little bit of like a spring and a bullet that goes through a shaft going back and forth to produce an impulse. Now it's extremely effective for scar tissue. It is also effective for more superficial issues, tendinopathies and whatnot. But for some of your more advanced issues, your more complex tears, your more complex arthritides, ultimately, focused shockwave has significantly more research than radial pulse wave and has significantly more benefit. Now with focused shockwave, there's a lot of differences. There's three major types of focused shockwave units. There's the old school method, and that's an electrohydraulic shockwave unit, which actually creates an electropulse using this electrohydraulic mechanism.
Which also seems to get the most advertising, by the way.
They get the most advertising. It's known as soft wave. A lot of chiropractors use it. And again, the technology certainly is good. It's outdated. Then there's the piezoelectric, which, again, I forget who the manufacturer of that is, but piezoelectric is a crystal, and that also is another way that the shockwave gets generated. What we use is the Stores unit, which is the one you'll be getting, is an electromagnetic, and that's a little bit more of an advanced technology, and it actually produces a very high-powered, very focused shockwave at the appropriate frequency that's necessary to do what we call mechanotransduction, taking an acoustic wave, transducing it into the skin through a medium, and then obviously having a desired effect. Like I said, the Stores unit in particular has significant amount of research. They're actually the first to the game with shockwave. They were the creators of lithotripsy back in Germany many, many years ago, which for most people, if you don't remember, lithotripsy is used to break up kidney stones. So Stores has been on the forefront. That's all they do. Stores has invested a lot of money in their engineering and research and has delivered their machine to multiple academic institutions all over Europe, quite frankly, all over the world, and heavily involved in the research aspect of it. They have certainly the most publications. When you look at PubMed and you look at all the research on focused shockwave, the majority of the time they're using some Stores unit or the electromagnetic per se. So I think it's very important that people understand that, yes, there's certainly a difference between radial pulse wave and focused shockwave, but even with focused shockwave in itself, the way that the shockwave is generated is also very important because certainly, like anything, if you're using outdated technology, you may not be getting the most desired effect. And I think that's honestly what a lot of people need to understand.
Talking about the research, and again, I'm a little bit of a research geek, I know you are as well. One of the challenges that I know that we have associated with that is when you look at another company who's saying, hey, by the way, we have the research to back this up, a lot of the times they're giving you abstracts.
Yes.
Or partial studies. Yes. The problem is, and I unfortunately the PhDs that they've screwed up my brain forever. I used to be the lovely clinician who'd go read the abstract, say I'm interested, and I'll read the introduction, I'll read the conclusion.
Sure.
Done. Discussion.
Sure.
Now the first thing I do is read the methods.
Yes.
And the problem is, if you're not getting the methods, you're not understanding the machine that's actually being used in the study, and they're using the data from a different machine to support their machines. I discovered this the hard way, of course.
Sure.
Because most of what I was getting was abstracts, and as I started reading more on it, you start noticing that the machines that they're using aren't the machines that they're trying to say is what is working.
Absolutely.
So I think that's a huge distinction that, again, the focal that we've been discussing and that we're going to be bringing into your office and that you've been using for quite some time, that is actually the machine that's almost all the research is based on.
Exactly, and I think also it's important to note that, exactly like you said, with regards to the methods, this machine treats a plethora of conditions, which we'll get into later, and it's important to understand the methodology that they're using because, obviously with anything, there are parameters. Even with our electromagnetic machine, you can certainly have an energy flux density very, very low to very, very high, and certain tissues are going to respond to certain energy flux densities as well as different frequencies. So it's great to also have that research that has been, done by some of the top researchers and scientists and orthopedic surgeons, like I said, in most of Europe. And you're going to hear me say a lot in Europe because, let's face it, European technology and European medical system, they're designed to actually keep people out of surgery and out of costly methods. So I always tell patients, I said, listen, they've been using this not only in European medicine, but, I'm obviously an American football fan, but, the European football, I mean, you're talking big money. And every single one of these sports teams are utilizing this technology to get their football players back on the field very, very quickly. But even more so, like I said, the whole notion of let's keep people from getting surgery. Let's keep people from costly disability. Yeah, that's why Europe has been the forefront of, quite frankly, all regenerative medicine, stem cell regenerative, PRP, and obviously
easily a decade ahead.
100%.
Easily. And that's the thing. Like, if you look at PRP in the United States versus in Europe, they're so much more advanced. You look at stem cell. First of all, the United States gets handcuffed a little bit because how we can harvest stem cells. Whereas those barriers aren't there in Europe. Now, focal is different in the fact that there is no harvesting.
Exactly.
Now, talk about how the focal actually creates that stem cell regeneration.
Sure, that's a great question because people, like I said, they'll look at this machine and they'll be like, really?
Whatever.
Like I said, well, what is this thing? Like, literally, I can't stress it enough. It looks like an old IBM computer I found in my dad's basement several years ago. But what this machine does is there's multiple semiconductors in this machine. And if you actually take it apart, people almost say that when they hear the machine operating, it almost sounds like a mini MRI. And that's exactly right. It's creating this electromagnetic impulse that's going to go through a very long tube and into an applicator head. Now, when that shockwave is going to penetrate, sometimes 5-6 centimeters below the surface of the skin, which I think is really important for us to stop and talk about.
What's that difference between radial?
Exactly. Radial, you're talking maybe you get a centimeter. And with certain lasers, maybe 1 to 2 centimeters. So you're talking some of the deeper layers, first off, I mean, especially if you have a patient that's, a little bit, on the bigger side, such as myself, with a lot of muscle, a lot of fascia. And if you need to target a tissue, let's say a labrum, there's a lot of stuff that you need to get through, right? So first off, I think it's important to note that the actual impulse is going to be able to penetrate significantly deeper to have that desired effect. The main principle that focused shockwave works on is this theory of mechanotransduction. It's taking mechanical energy, it's subjecting a cell to mechanical energy, and it's having a physiological effect. Let's go over what are some of those physiological effects. Well, let's first actually start. What happens? What's the pathogenesis when there is a tissue that's damaged, right? Obviously, we have a disruption in blood flow. We have inflammatory markers. We have, a significant delayed healing. I think a lot of people also forget that, tendons, ligaments don't really have great blood supply to begin with. So unlike when you cut your skin, obviously there's a significant amount of cell turnover. We're able to heal that very quickly. And a lot of patients, really, I always use that analogy because patients can't quite frankly understand why they've had this tennis elbow or why they've had this tendinosis that's been lagging for honestly, sometimes year after year, right? So one of the biggest things that you're going to hear us keep referring to is blood flow, blood flow, blood flow. What the focused shockwave does is it actually stimulates VEGF, right? Or vasoendothelial growth factor, which is going to help create new blood vesicles, right? Which I think is significantly important to note. It's also going to cause the release of exosomes, which for people that don't know, exosomes is like the foundation of stem cells, right? So an exosome release is going to carry things like lipids and proteins and all that stuff that's necessary to have stem cell tissue regeneration. So a combination of exosome release, combination of VEGF, it's all going to kind of focus, and that's why, again, we call it focus, because really you're talking an area this big. Unlike radial, where it's going to scatter a little bit, which again has its utility, but the focus, I always tell people, think about where the issue is, because fortunately when you have these issues, we're not talking a treatment area that's this big. Oftentimes we're talking of a few small pinpointed areas. So we want to be able to harvest that energy over those pinpointed areas. We want to deliver exosomes. We want to cause the release of VEGF. And those two things, honestly, together is what's going to help start to accelerate that tissue healing process. Now, like you had mentioned, there is no harvesting, and I think patients really feel very at ease with that, and they sometimes can't understand, well, wait a second, well, whose stem cells am I using? I said, you're using your own. Mm-hmm. And no stem cell is going to be better than your own. So those two combinations of things really actually kind of start to get people thinking, well, wait a second, so you're telling me that this machine is going to truly help heal my tissue from within? Exactly.
And that's one of the issues that I think where the United States fails, especially in the harvesting aspect,
Absolutely.
Is we don't understand, or I shouldn't say we don't understand, we don't handle well differentiated stem cells
Yes.
versus undifferentiated stem cells, which is where Europe lives.
Exactly.
Europe lives in the use. What is the difference? When you have a differentiated stem cell, let's just say that's a stem cell that's supposed to make ear cartilage.
Exactly.
You can't put it in a hip and make hip cartilage. It's going to make ear cartilage in your hip.
100%.
Because it's already genetically earmarked. Mm-hmm. And that's unfortunately how in the United States we tend to harvest most of our stem cells.
Yes, absolutely.
It's already been differentiated, mm-hmm. which is why we don't have the same results that we see in other countries.
No, you couldn't be more correct, and I think that's a really important distinction on why this machine has had so much benefit.
Because you're now actually simulating the stem cell specifically to the targeted area for that tissue.
Exactly.
So there's no harvesting needed. You're actually just stimulating that tissue to make its proper cells again.
Absolutely. And it's also important to note it's not invasive. Right, so basically how the procedure works is, we're cleaning the area, with some alcohol. We're putting an ultrasound gel, which a lot of people I'm sure have had, and that's just a simple medium. And, that's it. There's no needle insertion. The machine doesn't require fluoroscopy. It doesn't require the use of ultrasound guidance. And it's relatively, there's some discomfort to it, which I think is, almost to an extent important because it's diagnostic in itself, right? So, I mean, the procedure setup itself is really not very complicated. It doesn't require any use of anesthesia. It does not require to be done in a surgical center. So it really has been able to deliver stem cell technology at, quite frankly, a fraction of the cost of PRP and bone marrow aspiration and other technologies that they're using here.
That's actually a really... I wasn't even thinking about that for a second, but if you think about what the cost of either just a PRP injection, let alone having a couple, or stem cell. Mm-hmm. If you went through an entire treatment protocol with focal, you would spend less.
You'll still spend less
than you would for a single PRP or stem cell.
The average cost of one PRP injection, and I think it's important for a lot of people to hear this buzzword. PRP is where they're basically taking your blood, they're spinning it down, and they're re-injecting the platelets into an area, which has some good effect. The research on focus shockwave is better. The combination is really good, but oftentimes the focus shockwave is able to handle most of the injury without PRP. One PRP injection alone generally is anywhere from about 1,000 to 1,500 in our area. And typically patients need a series of 3. Bone marrow aspiration and stem cells can cost significantly more.
The other thing that I will report just from patients, you have patients get a PRP injection, they're like, yeah, I was a little sore. And you have other people get a PRP injection and they're going, I couldn't use my arm for 3 weeks.
And that's where the invasive component obviously comes in. Those typically you do want under ultrasound guidance because you are inserting a needle into the tissue and you want to see exactly where you're going. You want to make sure that you're not hitting any, nerve root, are you actually hitting the target tissue? And I think that's a really important thing to know.
And because it does create a significant inflammatory response, it's also how does that individual person end up with the inflammatory response?
Exactly.
Hence why you can see a broad spectrum of reactivity after that type of treatment.
Absolutely. So yeah, so no, like I said, I think that's it's really important that we educate our patients on that, because a lot of people, there's a lot of stuff out there, and I think it's a good and bad thing in today's marketplace that people can access all this information online. But there's a lot of stuff
Well, there's
out
a
there.
lot
There's a
of-
lot of
yeah.
misinformation.
There's one other differentiation that I want you to talk about regarding
Sure.
the difference between radial pulse and the focal.
Sure.
Now, I've been using radial for, I mean, at least a decade. I think we've had it in our office. To a point where I've had such great success, I actually bought one for myself.
Sure.
Now, I'll be honest, we'll talk about this a little later about success with the focal, but radial as beneficial, and you've talked about it. It's not like, hey, by the way, dump your radial. It's
No, of
useless.
course
That's
not.
not the point of it. But radial, when you get close to bones, kind of feels like you're rattling them.
Oh yes.
From firsthand experience, again, from one of the masters at the technique, I've had it right over the bone,
Sure.
and there's absolutely no rattle whatsoever.
Sure.
Why is it that radial creates that, whereas the focal does not?
Yeah, that's a really good question. Again, it has to do with that. First off, frequencies, right? So you're talking at a lower frequency, and the energy is kind of being spread this way. So it's penetrating the skin and it's kind of dissipating like this. So you're actually exposing the periosteum to a much broader area of like a pressure wave, right? And so, and obviously when that periosteum is stimulated, it's going to hurt. The focused unit, like I said, you're talking a cone this big. So you're really leaving the non-damaged area alone. You're not aggravating that periosteum, with the exception of the area that needs to be targeted. So yes, ironically, as kind of like we're talking about it, patients may be saying, well, wait a second. I mean, this sounds like it's a lot more advanced, it's a lot more intense. And the answer is, it is, but oftentimes, more times than not, people report it to be less painful.
I would, again, from
As
firsthand
crazy as that
experience,
sounds.
I would say this. If I was doing the same region that was treated, it would probably be twice as
Sure.
uncomfortable
I
with the
agree.
radial pulse as it would be.
I agree.
And to that same standpoint, I question, based on the science and what you've explained and taught me, is that I'm not sure if it would have penetrated into it because something would have gotten its way.
Sure.
Mainly the bone.
Mainly the bone, again, fluid, adipose tissue, fascia, muscle, epidermal tissue. It's a lot of layers. It's a lot of layers.
Now, what was the reason that you first started looking at it?
Yeah, that's a great question. And typically when people look at Shockwave, you're more of the common cause, right? They start with radial and then they move their way up to focused. I actually started with focus, which is very, very rare. And people ask, well, why? And I'll give you a little shout out. Your technique, honestly, for a lot of the superficial tendinopathies, I've had a lot of great success. And I still do. And it's wonderful. But we were starting to notice, wait, this technique is awesome. But you know what? A lot of our patients are coming to us now with some, deeper pathologies, hip osteoarthritis, knee osteoarthritis, some more advanced tears, grade 2 sprains of a tendon and a ligament. And, I'll kind of add a little business flair to this. The second thing is, doc, I got this, but the orthopedist said they can get me in like a month or two. And I'm like, a month or two? Like, well, that's not great.
Yeah.
So I was starting to say, all right, well, there's got to be a different solution, right? Because, listen, epidural injections are not the answer. And I think there's enough research to prove that, yes, an epidural, a steroid injection can certainly help mitigate the pain, maybe for 5 minutes, maybe for 5 weeks. But the truth of the matter is, it's not restorative, and I don't care what anybody says, it's going to continue to degrade the joint. And it's not just me feeling that way, obviously.
That's
there's enough
science.
research.
That's pure
It's
science.
science.
Yeah.
So anybody that wants to argue with us, obviously, it is what it
They've
is.
shown that even just the simple use of non-steroidal anti-inflammatories
Exactly.
like Advil, ibuprofen, even that in prolonged use is going to
Exactly.
degenerate cartilage.
So I think a lot of it was the response to our patients coming in with these common conditions, and the answer was, yeah, get an epidural steroid injection, you go see this person, this person, this person. And, to me, listen, telling somebody that was used to playing pickleball or wanting to go for a hike or play with their grandkids, you now need to live with this for 3 months before you potentially get any resolution. And the truth is, the further it goes along without any type of restorative treatment, it's just going to get worse.
Mm-hmm.
The tissue is going to further degrade. You're going to start to have some other compensatory myofascial issues because now muscles and tendons and ligaments that are not used to bearing as much weight are starting to bear weight. So I said, we got to figure something out. There's got to be a technology that we can utilize. And I've learned about Shockwave, and I've definitely, like I said, started seeing about the radial. And I said, what is this focus? What's with this buzz? And I started doing the research, and I'm like, oh my God, this is a machine that's actually causing restorative therapy. This is actually affecting the target tissue. It's stimulating stem cell regeneration. It's actually healing people, and it's getting them to complete their physical therapy with us at a much quicker rate. And truthfully, we can honestly get somebody back to, I would say, 80% function before they've even had their first MRI appointment. So I said, all right, well, this is a no-brainer, right? Because we, like I said, between the aging population and, quite frankly, even, people my age in their late 30s and early 40s, hip OA and knee OA is a real thing. You're seeing it more and more and more. And, I think those were the two biggest things, that kind of led me. For me, it was also an injury I had to my labrum. And, I was a power lifter in college, and, obviously adjusting, now for over 10 years, I was starting to have some significant issues, and, I was offered the PRP and whatnot, and, I had trialed a course of the Focus Shockwave, and, quite frankly, this was 3 years ago, and after 4 weeks of Shockwave sessions, in addition to some of my eccentric and concentric loading exercises, listen, I'm proud to say in 3 years I haven't had a single issue with this right shoulder issue. And I know it's anecdotal, but I'll be honest with you, for me, it's definitely more than anecdotal, because it truthfully, it saved my career. But it allowed me to continue to practice.
That's reality. It's like a labral tear for a chiropractor.
It's very common.
That could eventually end up career ending, because we're doing nothing all day long but pushing with our shoulder.
Exactly.
And that's a challenging thing to actually get through. So, look, all of this is absolutely amazing. What I also want to know is, dive into, you talk to the business a little bit about it. Why is it that it costs so much?
Yeah, that's a great question. In order to induce a shockwave, I think people need to understand the technology to generate a shockwave at a very specific energy density and a frequency. It requires very specialized equipment, right? I always tell people, listen, we take it for granted. We open up, God forbid we're sick. We open up the bottle, we take a pill, and it doesn't look anything insignificant. I think a lot of us can appreciate that there's been millions and millions and tens of millions of dollars in research, how a little pill can affect, a body part, right? Well, it's the same thing here, right? Obviously, there's a lot of technology, the components that are actually required to build a machine to deliver a consistent shock also costs a lot of money. And Stores is utilizing parts that, are in-house. They're manufacturing things in-house. They're not using any third party, which I think is very important. So a lot of companies are going to use these third-party part sources that aren't validated. You have no idea where they're coming from, and then they're assembling it, and you have no idea. You do a patient at 8 a.m., is the patient at 8 a.m. going to receive the same energy flux density as a patient at 4:30 p.m.? I don't know. With the Stores unit, because I know how it's built and I know the technology that has actually been manufactured with it, yeah, it is. And that's important, because truthfully, energy flux density is that is the treatment, right? That's like the equivalent of a milligram dosage in a medication. So I think people need to really understand that energy flux density, it's not just a number. That's exactly like when someone says, listen, let's take this person, we want 500 milligrams of Augmentin to cure your staph infection. It's the equivalent. Right? Because if you have a very bad staph infection and you take half a milligram of Augmentin, it's not going to do anything for you, right? Well, it's the same thing here. If you don't have the appropriate energy flux density, it's useless.
And it goes back to, again, using the word of focal, is that energy, rather than taking a pill, which then goes everywhere in the body. So how much is it actually getting to the area that you need to get fixed?
Exactly.
The focal is devoting all of the energy to the target tissue. And again, just speaking on that, because the second half of this, I want to talk about clinical stuff.
Absolutely.
I can say that you can move that device around, and when you hit the target tissue,
you'll feel it.
You are going to know you are on the target tissue. So not only are you going to have that focal response, the patient actually becomes part of the treatment.
Exactly.
Because you're talking about this pinpointed area, and the patient then becomes part of their treatment, saying, oh, I felt it a little bit more, move it back this way again. Because that becomes the diagnostic component that I found fascinating. So, all right, first of all, fantastic. I love getting all this stuff down and actually understanding why it is that we're actually moving to a higher technology, a more costly technology, but why we actually would use it with patients because of the success rate. Let's talk about, in our second half, let's hit the clinical. So I want to talk about conditions. I want to know where you've had your successes
Absolutely.
and otherwise. What are the things you want to jump to use?
Sure.
And then we'll get more into that. So
Absolutely. Sounds
stay
great.
tuned for our second half when we get into the clinical aspects of this device.